Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Lealani Mae Acosta. She's a neurologist. Today's Kevin MD article is Putting on My Daily Máscara. Leah, welcome to the show.
Thank you so much for having me.
All right, let's start by briefly sharing your story and journey.
Sure. So this article that I wrote, putting on my máscara, I wrote at the beginning of the pandemic, essentially. And I speak a little bit of Spanish, enough to be dangerous from the year I took
Yeah,
in college. And I noticed that there were signs up all over the hospital, of course, encouraging us to wear our masks in
yeah,
English and Spanish. And of course, the Spanish word for mask is máscara on the signs we had in our hospital. And I thought it was really interesting because I love words. I was an English minor. I do
yeah.
creative writing. And so I noticed the similarities between the Spanish word for mask, máscara, and the English word for mascara, which is typically associated with women's makeup. And I was going to be giving a lecture to the neurology residents, and you, well, there is some video, but in case you have audio, I don't usually wear a lot of makeup. I'm not wearing
Yeah.
any makeup. I usually don't wear any makeup. But sometimes when I'm public speaking, maybe I'll put on a little bit of lipstick or some tinted lip gloss just to look a little bit more animated when I'm speaking. And I was preparing to give this lecture to the neurology residents, and I was looking for my lipstick, which again I don't use very often. And I thought, Leah, why are you looking for lipstick to put on? It's going to be under your mask that you're going to be wearing
Yeah.
to give a lecture to these residents. So what's the point of wearing it? And it just really got me thinking about the daily appearance that we have, not only as physicians, but specifically as a woman physician, how we appear to other people. And so, why does it matter whether or not I was wearing lip gloss or lipstick? Why do some women really commit to wearing mascara every day, or they feel like they've got to have their face all made up in order to look like a doctor? And so it really got me thinking about what it means to look like a doctor, so to speak, and specifically as a woman physician, what people expect me to look like as a woman doctor. And, I thought about not only just makeup, but just about appearance. I mean, not to flatter myself, I'm fairly youthful appearing. I like to thank my Filipino genes for that. And, sometimes when I'm attending on the inpatient wards in the hospital, or even just when I'm seeing patients in my dementia clinic, because I'm a behavioral neurology specialist, I get a lot of comments, oh, you look so young, you look too young to be a
Mm.
doctor. And sometimes I feel like I have to look older. Like when I'm rounding with my team of residents, I got tired of the male intern being recognized as the attending by the patient when, I was the one who was the supervising physician. So I'd always wear my white coat and,
Yeah.
feel like I have to look a certain way. And so I basically wrote this article as a reflection of the expectations we have to look a particular way in medicine, again, specifically for women physicians. And really, at the end of the day, as long as we look professional and we act
Yeah.
professionally, how we look shouldn't matter as much. Certainly we should be clean and kempt and look and act professionally, but I don't think we all have to look like, for example, Dr. Barbie.
Sure. So you talk about those expectations, especially as a female physician. Do you think those expectations do they come more from patients or more from your colleagues?
I would say the majority of those kinds of comments come from patients because, I mean, again, part of this is because I'm working primarily with an older population. And so the comments of, oh, you look, look like my child, or you look old enough to be my grandchild, those kinds of comments. And some of them are meant to be kind, but some of them, there's this sort of undercurrent of, I don't know if I can trust you because you look too young. How long
Mm.
have you been doing this? Some of those kind of unspoken questions sometimes arise with that. Thankfully, I don't really get it as much from colleagues, even though sometimes, not to be ageist and a stereotype in and of itself, but sometimes I wonder if some of, my colleagues that have been doing this a lot longer, do they look at me, no white hairs? Well, I had
Yeah.
one, I plucked it out last year though. But,
Yeah.
do they take me seriously if they think, oh, she must not have been doing this for very long when I do have, over a decade of clinical practices and attending at this point. But, how do my colleagues perceive me in that regard?
So you've been practicing for a while now, and sometimes when you hear these comments from patients, "Oh, you look so young," and things like that, like how do you feel? How do you receive those comments?
I mean, I try to put a positive spin on it in terms of, joking about just it's one of those things that I'm grateful as I get older that I still look young, and I try to take care of myself and, all those kinds of things in terms of maintaining that youthful appearance. But, at the back of my mind, there is that question of, are they calling into question my authority or my knowledge base or my capacity to serve in this role? And so I really just underscore, I appreciate the compliment when it's given and just emphasize that I do have the experience and the training to be a well-trained physician in order to take care of whatever medical questions they have.
And do you talk about this issue among your other female colleagues?
It does come up sometimes, especially, about just, makeup or, oh, what should I wear to this conference? How does this blazer look? Should I wear a blazer? Do I have to wear heels? Those kinds of questions. That kind of stuff comes up not infrequently among me and my colleagues. Because the story I share in the article was even when I was applying for residency programs, my favorite suit to wear at the time was a navy blue suit, and
Hmm.
I was stressing out because I didn't have matching navy blue shoes. And I was complaining to a friend of mine who was in the medical school as well, and he said, well, why can't you just wear black shoes? And I said, you're a man, you don't understand. You can
Yeah.
wear black shoes with a navy suit and nobody bats an eye, but if a woman has a mismatched pair of shoes, then they perceive her as not caring about her appearance. And so having some of those conversations does come up more with my female colleagues as opposed to my male colleagues.
And that leads me to the next question. Do you feel that male physicians, of course, are less scrutinized for their appearance?
Mhm. To some extent, yes. I mean, I guess just based on my own personal experience, I haven't had many conversations with male colleagues about worrying, oh, is my mate, is this lipstick the right shade? Or, should I wear something to highlight my eyes? Or, does this color look good on me on stage? And not to say that my male colleagues don't care about their appearance, but I don't really outwardly hear them having the same kind of concerns or actively thinking about it on a regular basis like I do more from my female colleagues.
So, how do you feel about all of this in terms of female colleagues having that implicit association between their appearance and their professionalism? So, what does that say about the larger questions about how society views both men and women physicians?
I think it speaks to an older stereotype that's existed about, certainly for a long time, women weren't actually even trained to be physicians. And so there's a stereotype of the older man who is the physician, or maybe the female is the nurse or, some other healthcare worker, but, not the physician. And some of those stereotypes still kind of persist, even if not spoken explicitly, somewhat implicitly. And I think, we have to educate people that actually almost half of the women entering, well, half of the students entering medical school now are women. And a lot of departments and hospitals are really recognizing that we need more women to be represented
Yeah.
within their fields, and they're striving for equal parity, not only just in terms of numerical representation, but making sure that we also have equal pay, equal opportunities. A lot of studies have shown that, unfortunately, women are disproportionately not as present in C-suite roles or leadership roles or chair department roles or division head roles. And so really recognizing the role of women physicians specifically within the healthcare fields, and giving them that recognition and those opportunities that sometimes historically have been purposely deprived of them.
Now, of course, you wrote your article in the midst of the pandemic back in 2020. Now that we've emerged from the pandemic, people aren't wearing masks all the time.
That's
They're
true.
not wearing scrubs all the time. Have you
Mhm.
noticed any changes in terms of the scrutiny women physicians face in terms of their appearance?
I don't think necessarily for women particularly. I have noticed some trends just in the overall attire of physicians. Because I know, especially during the pandemic, I wore scrubs all the time just because we didn't
Yeah.
know earlier on about transmission and things like that. And I've transitioned mostly to my regular business attire in terms of the dresses and skirts and things like that. But I've noticed a lot more physicians are comfortable just wearing scrubs every day. Either in the office or in the hospital. And certainly there are some specialties that are kind of known more for wearing scrubs, for example, surgical specialties. But I've noticed even non-surgical specialties, a lot more people are embracing kind of the more, for lack of a better adjective, casual attire that scrubs is typically associated with in terms of instead of wearing, the suit and tie every day. So I've noticed that in particular. And just for me personally, just kind of appreciating my own evolution in honestly my own self perception about how I appear as a physician. So I don't wear my white coat as often as I used to,
Sure.
mostly because of transmission purposes, because I used to wear my white coat in clinic every
Yeah.
day. And I don't do that as much just because it's a little bit easier. And I just realized not that I was hiding behind that white coat, but I felt like I had to give that extra stamp of I am the doctor taking care of you. And I've noticed that since I haven't been wearing my white coat, I'm not really getting, it's not like the frequency of the, oh, you look too young to be my doctor
Yeah.
comments has gone down since I haven't been wearing it. So just noticing some of those personal changes myself.
Now, do you think that there's a balance between personal self-expression, whether it's through fashion or through cosmetics, and is there a balance between that type of self-expression versus professionalism?
I think so. I mean, certainly those are not mutually exclusive concepts
Yeah,
because I think people need to be authentic in terms of how they represent themselves. And I think they also have to bear in mind what it means to look like a professional. And so, for some women, they are horrified, for example, if their hair starts to turn gray or white and they're in a rush to dye it. And maybe that helps give them the confidence to appear more professional versus other women are fine with letting their hair go white or gray. And I mean, there have been some interesting studies in terms of that perception of, do patients perceive physicians differently if they appear a certain way, and specifically for women physicians as far as, the makeup and things like that. But I think generally speaking, as long as you are presenting yourself in a professional way and acting courteously, I think, we have physicians of all shades of the rainbow and all different kinds of, fashion sense, so to
right.
speak. So I think as long as we can represent ourselves authentically and still be professional, I do have a prop, if I may, with this that I can show you. So I also happen to be an avid knitter and crocheter, and I have a knit model of
Yeah.
Einstein's brain that I made that was published in the journal Neurology. And I'll see if I can put this on over my microphone here. But I often wear this around the hospital because I'm a neurologist,
Yes.
and people often recognize it as a brain. And when I first made this, certainly I was a little bit worried that people wouldn't take me seriously because I'm wearing a knit model of a brain. But I've gotten so many positive comments from both other colleagues and also just from people at the hospital, or even when I'm running my errands.
Yeah.
I had a lovely conversation one time with somebody at Trader Joe's whose mom was diagnosed with dementia, when they found out that I was a brain doctor. And so, that's just an example of sometimes, we can worry about how we're perceived by other people, but there's more to being professional than just quote unquote face value as far as how we look. And so that's why I just want to encourage, that kind
Sure.
of personal self expression, which is still, I think, well within the realms of what is considered professional.
You mentioned earlier that a lot of the attitudes towards how women are scrutinized in terms of their appearance comes from antiquated stereotypes. Now, you work at an academic medical center, so of course you see the next generation of physicians, medical students, residents, and fellows. So, what are you observing in terms of these new physicians coming up? Are they carrying the same stereotypes that we're talking about today?
Yes. So as far as students, I do think that they're not necessarily as rigidly adhering to some of the stereotypes of what a doctor is supposed to look like. Because I know even recently I've had discussions. I feel like, for example, within society, tattooing has become a lot more commonplace, and some people have been nervous about covering up. They want to cover up their tattoos for fear of not appearing professional. But I remember having a conversation once with a medical student that a patient who also had tattoos really commented on the fact that the medical student also had tattoos, and they had a bonding moment instead of that being something that turned the patient off, so to speak. And so I think some of those more rigid expectations about how we expect a physician to look have become a little bit looser with the current generation.
We're talking to Leah Acosta. She's a neurologist. Today's Kevin MD article is Putting on My Daily Mascara. Leah will end with some take home messages that you want to leave with the Kevin MD audience.
Mhm. I want to emphasize that I hope that people feel comfortable expressing their authentic personalities as far as their appearance and their dress, and still be able to maintain a professional appearance with their colleagues and with their patients. And I just want to encourage people to not feel like they have to be so committed to a particular stereotype of how a physician is supposed to look, especially for my female colleagues.
Leah, as always, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thank you.